Hello, my name is Lisa. I work on accident and emergency and I'm a sister. I've been here 12 years.
My name's Bianca and I work in accident and emergency. I've worked here probably around 15 years now between Hartlepool and North Tees.
Hi, my name's Paul Sims and I'm Deputy Head Porter at North Tees.
We see a lot of patients with alcohol and drug misuse over the years.
Violence and aggression is part of the job, albeit an unacceptable part of the job. And in 12 years I've seen a lot.
A lot of those patients can be quite challenging. They'll come in with alcohol-related incidents where they become aggressive, substance misuse. They're quite aggressive when they come in due to their intoxication. So that can happen on a daily basis.
Yeah, I remember a time over in Hartlepool, it was Ward 5. There was a guy who was in his side room. When I walked into the side room, I attended the incident, walked into the side room and the room was tipped upside down, where he'd mostly destroyed everything, and then I got greeted by, he was going to put an oxygen cylinder through my face.
I can remember one particular incident where a patient came through the doors of A&E, and this patient had only just been in and had returned via ambulance. When I asked her why she'd come back, she became very aggressive, obviously defensive, and she verbally abused me in a very unpleasant way. It was prolonged, and she also tried to physically attack me as well. But luckily, because she was on crutches, she couldn't actually get to me. But if she wasn't, she definitely would have hit me. This was in front of an entire waiting room, and obviously other staff as well had heard the commotion and had to come to reception.
You can imagine there were mostly female staff on the ward and they were very, very frightened. They kept well away from the room until somebody attended, so in respect to that, it was very, very frightening for the staff.
Well, it wasn't very nice for me, but it is something that we deal with.
So obviously myself and my colleagues, we do deal with a lot of patients with alcohol and drug misuse, but we just kind of look after everybody in the same way. But some experienced staff that have been here a while, we kind of expect that.
I've probably never been affected as much as this one because it was someone that was trying to hurt me. And it wasn't very nice for the patients waiting in the waiting room. Some of them did actually try and help, and also kind of made it clear that they weren't happy with the situation as well.
It didn't really affect my job, I just carried on as normal. You know, you just got to get on with the job to the best of your ability, but make sure that you're not going to get... I managed to resolve the situation pretty quickly, so it made everything safe.
I think that the patients that come in here, I think they know that we're nurses and doctors and we're caring people, and it doesn't matter how they treat us, we still have to look after them. And they do say, you know, you have to look after us, so they kind of don't treat us with a mutual respect. I think it would help if we had some sort of zero tolerance, in which we do have posters that say zero tolerance, but it's not really.
We do see the same patients over and over again, and they're violent every time. And although there's a culture of zero tolerance, as A&E staff we do not see that. It would be difficult to prove that that is the case because the same people do the same things. We do need a tougher stance on those people, and whether it's saying, right, you're not coming here anymore. It's difficult to balance it because we do have a duty of care, but it does seem to be that there isn't any actual deterrent.
We should ring the police every time it happens instead of kind of putting up and being nice, because we do put up with it. We do take and we kind of try to help them regardless of how they're treating us.
I think we should personally step down more on zero tolerance towards staff who are actually trying to treat the patients.
If there had been possibly a presence in the waiting room of maybe security or someone whose job it is to ensure that these incidents don't occur or to intervene when they do occur, then I think that may have stopped her from doing it. It's difficult to say. I think that varies from person to person, but I do believe that it would help diffuse situations perhaps, and discourage people from doing it in the first place and to know someone's there.